We are now live.
Thank you. A very good morning to each and every one of us. Abigail Marshall Cutting is my name, and I am the chair for the West Yorkshire Joint Health Overview and Scrutiny Committee. So welcome to board members. And just to let you know that this is also streamed live, so that those who are not able to, it's not a physical meeting, but just know that people who would love to be with us can still be with us by joining us remotely. So once again, thank you very much for joining us. Can I ask if we've got any substitutes for or apologies for this meeting this morning?
No, Chair.
Okay, thank you very much. Agenda item number 2, any members' interest? Please, could you let me know if you've got any pecuniary interests from members? It's time to disclose that. No? Can I see a nod from you all, please, so I know you're all there? Excellent, thank you. Okay, so it's recommended that this is a public meeting, like I said earlier on, so that people are not excluded from the meeting for the considerations of the items of business on this agenda. Just checking, do we have any public deputations today, Mike?
No, Chair.
Okay. Thank you very much. Now moving on to agenda item number 5, minutes of the meeting held on the 29th of November 2022, and that's on your agenda pack pages 5 to 12. Can I check to see that this is a correct record of our meeting? Yes, Councillor Hutchinson.
I'm prepared to forward it as to agree it's a correct record, but there are quite a large number of questions arising from the matters in it that, you know, on going through the minutes, there were a large number of questions within them, and I would like to see, and promises of information coming to this committee, and I would like to see whether they have actually been received, and if not, whether they're being chased up. So we were told that we would be provided by with a list of voluntary organisations that mental health patients would be passed on to from the ambulance service. I'm not aware that that's been received. We were told that we would be given sight of the dental needs assessment on which plans were being prepared for the dentistry. I don't think we've received that. We don't appear to have received information on the detection of oral cancers from the Cancer Alliance, which we were promised. And then there's a number of things that were coming through in short space. That funding being put into dental, we were told 3 months ago that funding was being put into dental practices over the last few months. Has that funding actually been received by the dental practices? Have they validated their waiting lists? So, you know, and is the Integrated Care Board confident now, which they weren't confident about previously, that the funding from NHS England would be received so that they would be able to commission dental services locally? So, you know, I think we need answers to those questions in relatively short space of time.
Chair, may I? It's Betty. May I add to one other to Colin's list?
All right, sorry. Just before you come in, Councillor Rhodes, I'll just Mike had his hands up, and then I'll come to you, Councillor Rhodes.
Okay.
I mean, if you want to take Councillor Rhodes' point first, I'll come.
Okay. Over to you, Councillor Rhodes.
Thank you, Chair. It's in addition to Colin's comments. On page 10 of the Tuesday, 29th of November, under it was agreed, item B, it actually says, the Director of Strategy, Integrated Care Board, be requested to circulate the needs assessment report that were taken to the Integrated Care Board in preparation for the changes in April, and to take that to scrutiny officers for them to circulate to members of the West Yorkshire Joint Scrutiny Committee. Now, forgive me, but has that happened? I haven't seen it, and that's another issue in terms of what should have happened and should have been circulated. Thank you, Chair.
Thank you, Councillor Rhodes. Okay, yeah, we will respond to all that. Councillor Smage.
Yes. On item 12, it was agreed to arrange visits to attend the. It's at Wakefield Hospital that we were going to attend to visit with the ambulance service staff.
The ambulance, yeah.
Was it
response to that as well? Yeah.
Was it the hospital or was it their call centre? Thank you. But with nothing in the diary, so yeah.
Yeah. That's okay. I'll bring you in now, Mike, if you don't mind.
I will follow up. My apologies. They should have been followed up before, and I will follow all those issues up immediately after this meeting. The visit to the ambulance service, they did contact us.
Sorry, can I ask, can you all hear Mike clearly, or is it just me? You can hear him clearly, right? Then it's just me. Okay, Mike, you go on.
The visit to the ambulance service, they did contact us and ask us if we could postpone that, given the pressures on the service and the industrial action that has been taking place. And so that was agreed, but we will arrange the visit. But the other things I will chase up as a matter of urgency after this meeting.
Okay, thank you very much. Any other matters arising from the agenda? Because we do definitely need some response, Mike. I do know we've had Toti's response, especially regarding the dental, the letter that we sent to Parliament. But we're struggling and having the same problem as well in Leeds in terms of response. So we still have to keep on that matter and ensure that we get a response to what we have sent through to them. Yes, Esther.
Thanks, Chair. Mike, I can speak to Ian today about that as well. I know that we've been waiting for the dental needs assessments from NHS England, so that's definitely on the mind, and we're trying to chase that up at the moment. So I'll speak to Ian today and see if we can progress those.
Okay, thank you very much. Right, before we go on to the next agenda, can I kindly ask that all board members introduce themselves and let them know which authority you're representing, so that people who are listening know who we are. And I'll start with Councillor Smage.
I'm Councillor Smage from Kirklees Council. Just on that last point, it would be good if we could have an update to the minutes on a regular basis, so we know, for instance, that the dental needs assessment is delayed from NHS England. It would actually be good if that was done. Yes, thank you.
Noted. Thank you. Kevin?
Yes,
you introduce yourself, but then you can tell me what you.
Yes, indeed. Yes, I'm Kevin Swift and I represent Wakefield. The point I wanted to make was that in the light of the amount of outstanding business, I'm wondering whether maybe now or maybe when we come to the end of the meeting, whether we think about whether July really is a little bit too long to wait until we can actually deal with the various loose ends that we have. Thank you, Chair.
Thank you, Kevin. Like from our Leeds, from the Leeds Authority, we did chase up and we were told we were going to be given some feedback in summer, of which I have written to say to them, what month do you call summer? Summer could be July, so summer could be August, and that is too long. So we are waiting to hear back, but as soon as we do, we would definitely keep all of you informed. Okay, Councillor Hutchinson.
Colin Hutchinson from Calderdale.
Thank you. Councillor Rhodes.
Betty Rhodes from Wakefield, and at the same time to enforce the points that have been made about the gap that's in between meetings, and the point as well made by Councillor Smage in terms of updating the requests that have been made. And I think it would be useful for us to be able to concentrate and plan a better system for the future, Chair.
Very well noted, Councillor Rhodes. Thank you. Councillor Ramsey.
Jackie Ramsey representing Kirklees.
Thank you. Councillor Harrington.
Good morning, Councillor Harrington from Leeds City Council. It's my first meeting. Apologies that I haven't been able to attend before. Thank you.
That's okay, and welcome, and thanks for joining us. Councillor Glentworth.
Hello, it's Councillor Julie Glentworth from Bradford District Council.
Thanks for joining us. Councillor Jamil.
Hi, good morning, everybody. Councillor Rizwana Jamil from Bradford.
Thanks for joining us. Councillor Soloway. Councillor Silloway on there. Are there any board members I've missed? Please feel free to introduce yourself. Okay, Mike.
Mike Lodge, Scrutiny Officer from Calderdale Council.
Thank you very much. Ben Marshall.
Yeah, Ben Marshall, Assistant Scrutiny Officer from Calderdale Council.
Thank you very much. And I can also see some scrutiny officers from other authorities here. So thank you very much for joining us. Okay, we're going straight to agenda item number 6, refresh of the West Yorkshire Partnership 5-year strategy working draft and joint forward plan approach. And that's supposed to be the Associate Director for Strategies to take us through that. So Esther, is that yourself?
It is, yes. Thank you, Chair.
Okay, so over to you now, and thanks for joining us this morning.
Okay, thank you. Thank you very much. And thanks so much for your time on the agenda today. And I know we agreed the last time I came back in September that we would keep working together on the strategy and the development of the joint forward plan. So I was really keen to come and talk to you today at this latest milestone. So alongside coming here, in terms of the strategy work, we've been trying to engage really far and wide with this work over the last 6 to 9 months. We've had some absolutely fantastic, really helpful discussions at some of the place health overview and scrutiny committees and the local health and wellbeing boards as part of this work as well. And we know that the way in which the new statutory arrangements in health are set up are just so complex. And with that, the requirements for a whole host of plans. So a big part of the work has been about making sure we're really focusing on meeting the needs of patients and communities and keeping that decision making in place as much as possible. And also to make sure we can really connect everything up in the right way so that we make the best impact for our patients. And to try and help with this, where possible, when we've engaged with any committees or boards, we've taken the work to sort of place committees and boards alongside refreshers of their own local strategies and plans so that we can really try and help people understand the nesting and knitting together of all our plans and strategies, because it is really complex. So in terms of the West Yorkshire strategy, if you remember, our strategy refresh process has been designed and conducted by a group which reflected the entirety of the partnership, and it included colleagues from each of the 5 places leading on behalf of their place. And it's meant that we've been able to consult with over 60 formal and informal committees and boards and groups, and there've been a lot more individual discussions as well. We've also gathered the outputs of engagement which has taken place over the last year to feed into this strategy, both from Health Watch and also from a whole host of local place engagement which has happened in health and local authorities who are particularly good at that engagement. The draft you've got in front of you is the version that was considered by Partnership Board, who own the documents, in December. As I mentioned, we've now shared this with all of the health and wellbeing boards, and the last one is Bradford this morning that's happening, and we're now in the final stages of getting comments before finalising at the March Partnership Board next week, allowing for tweaks for the document up until the end of March. We've tried to keep consistency with what we've shared, so I must stress the document has changed quite a bit since the version in front of you today, as it's constantly evolving, but we wanted to make sure there was that consistency in public so that there wasn't any confusion. So the latest documents that you will see with the Partnership Board papers, which is being published today, is there's a much stronger narrative now around local authority pressures, digital agenda, children and young people, primary care, and also a much better balance between that being ambitious but whilst recognising the realistic situation. So the document that's going to Partnership Board today is a designed up version which reflects all of those changes. So as soon as those papers are published, I will forward that to Mike so that he can share that with you and that you can provide comments outside of this meeting as well on that version. As I said, we're still fielding final comments. We've had some great input from across the places. I was at Wakefield Overview and Scrutiny a couple of weeks ago. They gave us some really helpful comments and challenges around that, particularly about having achievable targets, which was really helpful. So alongside that strategy copy, we're now also in the throes of developing the delivery plans to set out how we will deliver this strategy. And remembering that the delivery plan, the joint forward plan, is owned by the Integrated Care Board, so it's slightly different. And in West Yorkshire, we're taking the approach of doing this in conjunction with the development of more detailed operational plans for the year as well. So bringing the two processes together so that we can tell one story of how we'll deliver the strategy through the 5-year plan and have the detail of that first year as well. So that helps us prioritise and phase the work in the right way over the next 5 years. So as I said, the Joint Forward Plan is owned by the Integrated Care Board. There is a national deadline of completion by the 30th of June. However, we're really aware that there is a chunk of time which is through the election period where it makes that a little bit more difficult in terms of engagement and consultation. So we're keen to have had a lot of the discussions before the end of March so that we can iterate and finalise by the end of June. So we will, of course, come back to the committee with a draft copy of that Joint Forward Plan. So the comments from councillors regarding an extra meeting before July would actually be most helpful to us for that, and in making sure that you have that opportunity to comment on and input into that Joint Forward Plan. So as part of the Joint Forward Plan work as well, each place will be developing their own plan for the next 5 years, and that'll be led and owned by the place committees of the ICB. And this will set out delivery against the NHS must-dos, the 10 big ambitions in the West Yorkshire strategy, the delegated functions from the Integrated Care Board, and also local priorities that are for each place because of the particular makeup of each place. And they'll be set out in the local health and wellbeing boards. We do have a statutory requirement to consult with the public on the Joint Forward Plan, and you will hopefully have seen that this started on the 10th of January and finished last week on the 20th of February. It's a really important part of the work to be able to develop the plans. Early themes that are coming out, we're just working through the final report on that. A mid-consultation report is on our website, but early themes are what you would expect to see. So things around the money, the finances and how we spend that, access to services, particularly around GPs and dentists, getting the basics right around care and services, our workforce and the coordination, that being joined up and people not falling through the gaps. So this will come together with also the place committee plans and also the additionality of the things that we do on a West Yorkshire footprint as well. So where we think that there is that opportunity to do things together better. So that might be if it's an issue that's difficult to solve, or where we need the scale because of the nature of the service, or where there's some good practice to share. So a good example of that is the Healthy Hearts work that came from Bradford, but the results were great, and the impact to health and wellbeing of patients was so good that we wanted to share that across West Yorkshire. So just being really clear, the detail will be in that Joint Forward Plan. That's where most of the information about how we're going to deliver the strategy will be in there. The strategy itself, whilst quite long because it is a complex system, that is a high level and in terms of our ambition and how we will work together to deliver the strategy. But the actual delivery, the actions, the targets will all be in that Joint Forward Plan. So I'd really welcome the opportunity to come back later in the process to this committee to be able to share emerging plans with you and get your valuable overview and input into that. So I'll leave it there if that's okay, Chair, and give the opportunity for any questions.
Okay, thank you very much, Esther. As you all know, we have just the one agenda today, so do feel free to make as many comments as possible. And we have the time, so just take your time. And over to you, Colin.
Thank you, Chair. My understanding from reading the report was that the Joint Forward Plan is supposed to be developed from the place-based plans, which were supposed to be coming to their final draft by the end of March. From what you're saying, it sounds the other way round, that the Joint Forward Plan is then being used for places to develop their plans from. Have I got that the wrong way round?
I think perhaps that's in how I've told it, Councillor Hutchinson. So it absolutely is from the place plans. So the way that we intend the document to be, the Joint Forward Plan, is we will have something up front which is around the strategy that the plan is set out to deliver. Then we will have each of the place plans in there, and then there will just be the additional bits that are things that we work on together across West Yorkshire. So no, absolutely, the place plans are at the heart of it, and from the start we're not dictating how they need to, what their content needs to be, or accept that it needs to cover those 4 elements. But the detail is definitely for the places to pull that together based on what they know is right for their place. So it's certainly not us telling them what to put in their plans. The joint forward plan, because our system is quite complex, is built up on a number of different elements. The place plans are obviously one element of that, but there are some things we do together as well, if that helps. I perhaps just didn't describe that quite well enough in the paper.
And this public consultation on the joint forward plan, which apparently began on the 10th of January and is now closed, and was supposed to be a consultation with the 2.4 million people living in West Yorkshire. I'm afraid it passed me by, and I try and keep reasonably abreast of these things. What was the actual planning for this consultation to be rolled out and to get it in front of as many people as possible?
So our the consultation has been led by our comms and engagements colleagues across West Yorkshire, but also all of the places. So each of the place communication leads has worked with the communication leads across all the organisations in their place to get the messages out. So the communication lead for your area should have been working with the local authority and with other partners to be able to get those communication messages out, to be able to use the maximum opportunities to spread the consultation through social media, through existing engagement channels that are all already happening. So unfortunately, I can't speak for exactly for your place, but I do know there was that sort of tiering of trying to make sure that it spreads far and wide, and there was a very clear plan through all of the communications and engagements professionals in each of the places. It wasn't West Yorkshire doing it all; it was very much the places in as part of that.
I can't have been paying attention, obviously, but with the previous iteration of the plan strategy, obviously there were the 10 big ambitions, and most of those still seem very valid now, even though there's been the disruption of the pandemic and the financial situation across the country. But I'm concerned that the figures that we've been presented with are most of them are very much out of date. So, for example, looking at the gap in ambition 1, to narrow the gap in life expectancy between the most and least deprived, the latest figures are only 2018 to 2020 and had shown that up till then, there'd been very little change achieved. In terms of ambition 2, the improving the health of people with learning disabilities and mental health problems. The gap in terms of people with learning disabilities receiving a GP health check is still under 50%, but the latest figures, most recent figures that were presented, of 2017 to 2018. The figures that show rapidly increasing severe obesity in year 6 children are only figures up to 2019-20. And the suicide figure, the ambition 5 to reduce suicide by 10%, all the indicators were all on a steeply upward trend up to 2018-20, which is the most recent figures that we've been provided with. So, and also the ambition 6 to try and reduce antimicrobial resistant infections. The figures are up to date, but they're all over the place. It suggests improving prescribing practice in Calderdale, Bradford and Airedale, but deteriorating prescribing practice in Wakefield. And I was just wondering how much, given that so many of these figures seem to be very out of date, how much attention is actually being given to these 10 big ambitions? What priority is being attached to them? And is anything being done to improve antibiotic prescribing practices in Wakefield?
Thanks, Councillor Hutchinson. Some really important points there. The issue that we have on the data is that a lot of the data for many of these ambitions have data lags, whereby it takes some time for the information to come to fruition, and so particularly around the life expectancies, that data does have a significant time lag on that. It's a little bit of why it's so important for us to make sure we're not just focusing on the quantitative data, and that we also look at some of the qualitative data as well. And that's something we're really focusing on in the joint forward plans, about trying to build that into the work we do. But though that data that has been pulled together was pulled together in the autumn for Partnership Board and was the most up-to-date data that was possible at the time, what we need to do is we need to get better at considering whether that's the right data, whether there are other things that we can measure. And again, that's part of the joint forward plan work, so that we can make sure we've got as most up-to-date information as possible, that we have some really rich qualitative data that sits alongside it, particularly around experience of care, which is something that we're really putting in quite a significant focus on, because our joint forward plan will need to be refreshed every year now. That's the requirement, and that's what we would want to do as well, to consider where we've got to, what the impact is we're making, and do we need to course correct as a result of that. So this is why this joint forward plan work is so important. We've spent a lot of time on the strategy, and the lead-in time in terms of the guidance that's come out nationally around the joint forward plan doesn't necessarily really reflect the huge amounts of work that needs to be done to get this right. So absolutely, really, we need to also consider about whether we have the right systems to be able to gather that data. Do we need to have a little bit more resource around the analytics of that data and how we use it in the right way? In terms of how we're doing things across the places, and you mentioned AMR there, that's a really good example of why we have a programme at West Yorkshire, so that we can, if one area is perhaps struggling a little bit more, probably for some very good reasons, is there some practice elsewhere that we can use to be able to help that place in terms of how they progress their performance in that? And that's a little bit more of what we're trying to do as well, to be able to build in that improvement way of working, so that we can spread promising practice across all of our places. You mentioned about the ambitions, and are we focusing on those? And it's a really valid question when we have a lot of things coming from NHS England saying you must get that elective recovery right, you must get the flow through the hospitals. And as a board, they're having those conversations about, do we still have a focus on the 10 big ambitions? They were having that conversation the other week, actually, and they're still very much committed to having that focus, that there is the balance. We still need to do some of the elective recovery, but we also can't take our eye off the future, and we need to have that focus on the 10 big ambitions as well. So I can honestly say that came up very strongly, that they are absolutely committed still.
If I may just briefly, Chair, I think it's often said that the NHS is awash with data but very little information. And so I think it really is important that we make sure that qualitative data is very, very subject to sampling error. You can make it tell whatever story you want, quite honestly. Whereas the quantitative data, particularly at population level like this, tells an awful lot about whether we are actually achieving those ambitions. And it also opens the way to us questioning, if we don't seem to be achieving it, what are the factors that are at play? And I think we neglect that at our peril. And as I say, there is such a huge amount of data available. It's just a matter of organizing it into a way that will actually inform us about the success in pursuing the strategy that we're at. So I would really encourage the partnership to get their act together to make sure that they have got as close to real-time data as possible to guide them.
Thank you. That's a really valid point, Councillor Hutchinson.
Absolutely, Councillor Hutchinson. Thank you very much for that, for your contribution there. Councillor Ramsey.
Thank you very much. Thank you for your presentation, Esther. One of the things that I hope this is okay to say is that if there is a paper due out today that updates this, the strategy, it feels that any detailed discussions on the paper that's been provided that was put forward from December, it feels like those detailed bits, no longer feel valid. We'll have to just wait and see the paper and make sure that those have been picked up. So I'm not going to go through some of the stuff that I put by page. There's no point. I'll wait and see what comes out from the paper that comes out today. So I'm kind of disappointed about the timing of this discussion, if that's actually the case. Fully support what Colin was saying about are we actually making a difference, and can we evidence that we're making a difference? And those metrics are very important. A general point that I'd make about the paper is that there are some really laudable things in there about poverty, inequality, cost of living crisis, climate change. But we know that it is very difficult within the partnership to ensure that we impact on some of the things that are causing those, and therefore we are potentially designing creative art schemes to support people that have severe depression because their housing needs are so great. And I accept that it's impossible to achieve some of the great ambitions that are in here, but we need to think about that real basics. What difference can we make? And I suppose my last thing is, there are some things that are that you've put in the paper that are about things like national living wage and workforce and things like that, which we know that we're drifting the wrong way on our workforce. And again, it's this bit about we're looking that the paper looks really good, but we know that we're drifting, and it doesn't match reality. But I will wait for the new paper to come out and comment individually on that. But see what you've got to say.
Thank you, Councillor Ramsey. And I completely take on board that the timing is unfortunate. It would have been lovely to have brought the latest document to you today. Although what I will say is that the broad tone and content of the strategy hasn't changed. It's just strengthening around some of the areas. And you're quite right that ambition versus reality has come out in a lot of our conversations, and so that is a little bit more strengthened in the strategy. It's something that everyone has picked up. We could say we're going to do everything in the world, but if that's not the reality, then that's not going to be helpful at all, isn't it? Again, the evidence making a difference is just so important, and there'll be no point in us looking every year and evaluating, sort of refreshing our joint forward plan if we don't know what's been delivered and we can't say what the impact is been made. So that will be very much in that joint forward plan development work and will be really important. And in terms of the creativity has actually been in health has been strengthened in the latest version. But I take your point that fourth purpose of the ICS in how we sort of try and influence some things that aren't in our direct control is so important. And again, it's another thing the board talked about in a development session they had recently, and again committed to the fact that actually that is still something that they are committed to and want to have a focus on, because we're not going to get into that preventative way of working that we are all seeking to do and make that real difference if we don't focus on some of those wider issues that we don't have that direct control over. So that does absolutely still remain a focus of the ICB and the partnership itself. But I'm also happy to pick up a conversation outside of this once you've had a look at the document, Councillor Ramsey, if you'd appreciate that. That wouldn't be a problem at all.
Okay, thank you very much, Esther, for that response. Councillor Smage.
Thank you. I wanted to pick up on communication as well. I think it might be helpful to look at how the communication has gone beyond health organisations, so into local councils, etc. I think that would be helpful to actually know if that has happened, so that you're reaching more people than just your own communication networks. I wanted to talk about ambition, because while all these are laudable ambitions, absolutely, and health inequalities is in there, and appreciate that health inequalities is in there because it needs to be in there. But I agree as to how are you going to actually deliver on a lot of the things that you're putting in this plan. But there are real problems in the system, and I didn't sort of get a feel from this document as to how this strategy is going to, in actual fact, help work towards trying to deliver against, trying to help those problems. But I particularly wanted to ask, I read the cancer item, and there's something in there that I just don't understand, and I hope you can help me. On page 12 of the document that we have today, it says that the net number of referrals into our local cancer services, including reduced volumes during the acute phase of the pandemic, has closed. Now, that is what I don't understand. Have I read something completely wrong? Because I just don't understand how the net number of referrals has closed. They then goes on, almost all reduced treatment activity has been recovered on the same measure. I just don't understand those 2 points. I wonder if you could help me with that, please.
Thanks, Councillor Smage. I will go away and have a look at that and speak to our council lead, because I suspect what it is perhaps a word missing, and that may well be in the latest version. So I need to check, because it sounds more like the gap will have closed. But I will double check that, if that's okay, and come back to you. In terms of the strategy, help, it's showing how it's going to deliver sort of those reductions in health inequalities. That level of detail will be the joint forward plan, which I think is why it's so important that this committee gets the opportunity to look at that when that's in draft, because the detail is in there. The strategy is the high level ambition. This is our North Star, where we're wanting to go. The detail is very much in the joint forward plans, describing what we're going to do, by when, and how we're going to do it, and how we'll know we've achieved it. That should be in the detail of the plans, and why this committee should be able to have a sort of an oversight and an input into that is really important. But I'll check the cancer section, and I will speak to the council lead and just come back and confirm that with you, Councillor Smage, if that's okay.
Thank you, Esther. Any supplementary question, Councillor Smage? You're happy with her response?
Yes, I would like to know what time frame somebody's going to come back. But I just felt that the ambitions there don't seem to address the problems, and I think that part of it hasn't been addressed in the answer. Thank you.
So in terms of the ambitions, they were part of the engagement. So as we've engaged far and wide, we had really strong messages back that those ambitions were the right ones still. The data in the appendix sort of really highlights that those are still issues. We probably could have added a number of new ones, but that perhaps might have taken the focus away from being able to actually deliver some of this work, rather than having quite a large number of ambitions. If there's anything in particular that you think that perhaps we need to strengthen around that, though, I'd be really keen to hear that. And in terms of responding, I'll certainly come back to you in the next couple of days, Councillor Smage. That's not a problem.
Okay, thank you very much, Esther. Councillor Smage, she says in a couple of days, so I believe that's before Friday. Right, okay. Councillor Swift.
Yes, thank you, Chair. First of all, I'm sorry I wasn't able to join the committee effectively for the pre-meeting. I did actually manage to get on the threshold several times, and then unfortunately it kept defaulting to a black screen. So in the end, I aborted trying to take part via my Wakefield Council laptop and switched to an entirely different device. Like Councillor Hutchinson, if it hadn't been for a family member involved in a standing participation group, the public consultation would have completely passed me by as well. I must be honest in that respect. My second point, I think, has been slightly overtaken by Esther's comments a minute or two ago, when she said that really, if we're wanting to talk about what will be done and by when, really, it's the joint forward plan that we need to be looking for. Now, I think that's quite important, because if you are to evaluate the outcomes of anything you're doing, the numbers need to be fairly clear. And one of the things, and I'm repeating something I did actually say in the Wakefield scrutiny, is that virtually all the ambitions have got laudable outcomes to be achieved next year. Now, I suspect even assuming that the data we've not got has actually been moving in the right direction rather beautifully during the gap years, which I think most people suspect not. Even if that was so, to achieve all these things by next year, 2024, would be a really rather Herculean achievement. Now, the problem is that if you have a stated target that you can't achieve, however nice it might have been to have done so, then you've absolutely no way of evaluating your performance against that target. And for a document which will presumably go public in its final form in maybe about 3 months or so, maybe a little bit longer, to have targets that are to be achieved in 6 months' time, I mean, there are always things that are out of date, but that seems to be kind of like taking it a bit far. And I really would suggest that it may well be that the document that we're all going to see over the next few days, it may well be that a lot of that's corrected, but you really shouldn't have something going public that's got targets that are actually demonstrably, statistically unachievable. And I do wonder whether there's the opportunity to change those things. But I take the wider point that we need to look for the joint forward plan as well. Thank you, Chair.
Thank you, Councillor Swift, and I absolutely agree. And the latest version that's in Partnership Board today has been tweaked to reflect that. And I think what would be great would be if this committee would be able to look at some of those trajectories in the joint forward plan, to have some sort of real overview of those ambitions around that over the next 5 years. That would be really helpful. And in terms of the public consultation, I think clearly this is a view from a number of the different places. So that's something I need to take away and talk to our communications and engagement lead. And as the learning process, perhaps we need to just look into that a little bit more and find out who's shared what and where, and so that we can make sure that sort of is improved next time if that's not been going out in the right way. I think certainly the plans for it to have been there, and all the leads in all of the sort of local authorities and the places have been worked with, but something has clearly fallen down, and we need to make sure we learn from that for next time. So you've got my assurance I will take that away to look at.
Okay, thank you. Councillor Swift, any supplementary questions? Are you happy?
No, thank you. No, thank you very much indeed. Thank you.
Okay, thank you. Councillor Rhodes, I've seen you.
Thank you, Chair. Hello, Esther. Nice to see you again. Obviously, I've stayed to the last because we had a big conversation at our meeting about this. So my colleagues here have echoed in terms of their concerns across the patch. Now, one or two things from your presentation today. First of all, there's a document going to the ICB board today, which we will be able to have sight of tomorrow, where, as I understand it, Esther, you're saying some of it that we've already got here have been tweaked. Okay. Understandable, understandable. I think the other part of what's been mentioned today is echoing what we mentioned and had questions on from our members at the Wakefield scrutiny. Now, you've mentioned consultation and engagement with local leads in the places out there. Is it possible, and this is a throwaway, but I think relevant, is it possible that that local lead has actually been in terms of the Health and Wellbeing Board, where I understand there's been involvement, obviously, in terms of the consultation on this document, which, by the way, escaped me as well for the consultation process across our patch. And in terms of the leads, Chair, I'll put it out across everybody today. Could we, as a scrutiny, joint overview and scrutiny, have the names of all the leads across the authority? And indeed, I think welcome information would be the views from the leads in the authorities, which from an overview point of view is very helpful to the JOSC. So we can actually try to work together from to the place and the JSNAs in every place out there. I think we have gone over at our committees and again today the issue that reflects a wish list, as I called it at my committee, rather than actual factual plans of how they're going to be implemented. Now, we've heard today that these joint plans, 5-year plan, the ICB, the joint forward plan is, did I pick it up right, Esther, that it's targeted for the 30th of June. Now, that's after the plan, the format of strategy, as I understand it, has gone to the ICB. The strategy has been tweaked, so that's looking as though that's an acceptable way. In conjunction with that strategy, then, where are the forward plans now? I think we've got to emphasise, Chair and members from our committee here, as a joint committee, not only the value of having the place engagement, but at the same time, from a joint committee, that we're actually aware of and involved in from an overview point in terms of what the planning, joint planning is going to be, in particular, to the 10 points that have been raised. And I think particular at this point as well, Esther, is the next question is, for the comments from my committee and today, how are you going to prioritise those 10 points? It's a wish list. They need to be prioritised. Some of them, of course, may be easier than others, which I doubt. Well, for instance, when you look at the amount of children over the years in poverty and how that's escalated, it's incredible. So how are they going to be prioritised, Esther? Because the prioritisation of those 10 will actually have to equate to the planning process of the joint plan that you're putting forward to match those priorities. And I think those are the things that we have to get our heads around today. The other part of the timing, I have to say, is concerning and it's worrying. From January to now, a consultation that seems to have skipped us all by. The involvement of X amount of people, we never get any statistics out of it in terms of what was the volume of the people that got engaged maybe through Health Watch or whatever. What were their thoughts? Were they all compliant? Or was there any issues that came out in the consultation that yet have to be worked up in terms of the community, the people, the residents, not those involved, but necessarily the receivers of care and medical attention? I think that's important, that that information matches what your priorities are and what the plans are. And really, to wait till June for the forward plan, my question on that is, from an overview point through the JOSC, is there an avenue for this JOSC committee to have sight of those forward plans from the beginning, rather than the expectation of challenge at the end? Thanks, Chair.
Thank you very much, Councillor Rose. Very well said. Esther, could you respond to that, please?
Yeah, thank you, Chair. And thank you, Councillor Rhodes. I'll try and answer all the points, but if I do miss anything, please do just say. In terms of the timing, I agree. The timing is not helpful. That it's over an election period for starters. I think NHS England thought they were being helpful in giving us a little bit of additional time, because originally the plan was March, but we didn't get any guidance out till the new year. So that's not been helpful. We as a system are actually a little bit more on the front foot than other places, because we've started some of our work. We've got a strategy in place. We've started the consultation, etc. I absolutely don't intend that this plan comes as a complete document at the end of June for you to look at. I think that's why I'm agreeing with perhaps if you had an additional meeting of some sort, because it would be helpful to do that as we develop the plans, rather than it being at the final point. That would be really helpful, certainly for me, and I think it would be better to be able to sort of get some valuable input at that right point. In terms of the sort of connectivity with the places, when I talk about the place leads for the communication and engagement, we have a West Yorkshire communication and engagement lead, who you all know, Karen Coleman. She works with the team across all of the places. So in the place committees, there are people who lead on communications and engagements. They then have their links in with communication leads across local authorities, police, voluntary and community sector, and a whole host of other partners. So it sort of flows out, the information flows out in that way. I certainly agree there's something that's not worked here that we need to take away and have a look at. And I will speak to Karen about how we might go away and be able to give you the right links into that, because I do take your point, Councillor Rhodes, about you knowing who those leads are and then being able to make that connection yourselves with them as well. So we'll take that away as an action. In terms of the prioritisation, it's an important part of the business planning process. I mean, this in its entirety is a business planning process for our partnership. We have a strategy that sets where we want to go. We will be developing plans as to how to deliver it. And then the end bit of that is, are we set up in the right way? Are we using our resources in the right way to be able to deliver those? And it's a bit sequential in how we do that. As I said, the board is still absolutely committed to the 10 big ambitions. There is that balance between the national targets and what we know we need to do nationally. And let's be honest, those are things we would want to do as well. They are things that our people in West Yorkshire are telling us are important to them alongside this other stuff. So certainly, they are being prioritised along with those national asks. It is a case of how are we going to do all of those? But I understand we can't do everything. So that idea of how we phase things through the 5 years is going to be really important. And why we're linking in operational planning, which is year one of our joint forward plan, year one of our delivery of the strategy, will help us know, well, if we're having to put X amount of resources in year one to be able to meet these, the operational planning, then how can we make sure we're phasing things so we're still doing everything else and we get to do it in the right way? So it is complex. It is really hard, but it's also really important that we don't lose that emphasis. As a system in West Yorkshire, we're really proud of really trying to focus on some of those wider determinants. and having, looking at some of the things that aren't traditional. You must meet X targets, and that's something that we're proud of and we want to continue with. So I know that's not a definitive answer, Councillor Rhodes, on that, but hopefully gives you a flavour of they absolutely will still be strongly prioritised, and the board is committed to that as well. And I'm not sure whether in terms of the consultation report on the website, and I will make sure I get a link to Mike for this, there is a report that summarises midway through the consultation period what kind of things had come back, and at the moment they're working on the final report as well, and that'll have all of those details of the statistics and how many people have responded and what kind of responses there are. So all of that will be in the final report, but I can make sure that midway report that's available at the moment is a link to that is passed to yourselves through Mike as well. I don't know whether I've missed anything out of that.
No, you've done very well, Esther. And obviously, the last question I would like to ask in terms of the priorities. When will you be able to inform our scrutiny chair and office for us as elected members of JOSC and locally through the place, what priorities in order you and the ICB board have decided are the important ones? Because obviously they're all associated with funding streams and targets, etc. Is there a point pretty soon, as Kevin has pointed out, when you're going into your first year of strategy, is there a point by which you will actually know what, from 1 to 10, in what priority the board will be addressing them? And lastly, I understand, and forgive me if I've got this wrong, dentistry obviously is a big one that's coming across to the ICB in April. We are going to have a further meeting on that. I understand that there's roughly about £400 million underspend in dentistry through the year's budget. Now, is that going to flow across to other priorities? Or at the moment, because we are in such a dire position with dentistry, how is that going to be spent?
So in terms of the priorities, they aren't in ranked order. They are all priorities that we will be looking at. Now, what as I said, it will be the phasing and sequencing of the actions within to address each of those that may well be sort of phased and prioritised over the next 5 years. But each of the leads in those areas will be working on that as part of that joint forward plan work. So when we come to you with the first outcomes around what's going to be in the joint forward plan and what the places are saying as to how they'll deliver those elements of the 10 big ambitions, that should give you some of that information at that point. In terms of the dentistry budget, I'm not an expert in dentistry, but the dentistry budget is to be spent on dentistry. So I'm not, that won't be spent in other priority areas. Obviously, it might be sort of about how we build a little bit more prevention work into it. That could be one possibility, but certainly it's not a case of trying to use that budget elsewhere. This is an important area of work for us as a partnership. So that absolutely is money for dentistry.
Thank you, Esther. Thank you, Chair.
Thank you very much, Councillor Rhodes. Just a supplementary question from Councillor Rhodes. Now, Esther, you have this report and this paper that's going to come out tomorrow. And you're going to, with the consultation that you've had from January till date, and we still do not know in terms of data how many people have responded. So what is actually coming out in terms of what responses are you using to bring out this paper tomorrow?
So the consultation is for the joint forward plan. I perhaps haven't made that clear. For the strategy, we used the engagement that had happened across Health Watch, across all our local authorities, across our place committees over the last year. The public consultation is a statutory requirement for the joint forward plan. So that's why the timing is as it is for that. That will inform the development of our detailed plans to deliver the strategy.
Right, okay. Thank you very much. Councillor Smage.
Thank you. Just to be clear, Esther, are we talking about the document for the partnerships meeting on the 7th of March that you're talking about? Because that is actually public at this moment in time. The partnership papers must have been published today, I think, rather than tomorrow, because the meeting's on the 7th of March, so they've got their days in which they have to publish it. So I'm surprised that the committee couldn't have had a copy of that document to have looked at before this meeting. If it was going to be made public today, then I'm surprised that we couldn't have had that document. I've also looked at the document online. This is the problem of being online when you're in a meeting, isn't it? You can look things up. But there doesn't seem to be any engagement information in that at all. But the description is actually to approve the final draft of the strategy. So can you tell me how any comments we make today will be fed into that final draft if the document that is there is considered the final draft? Can you also let us know, please, how any comments previously made from scrutiny panels have been fed into that final draft? And also, can you tell me how you're going to put out the engagement statistics, because I just can't see them there. Thank you.
Thanks, Councillor Smage. I actually checked directly before this meeting and the papers hadn't been published at that point. I can assure you otherwise I would have shared immediately and explained to you. So that's the reason. As you can imagine, the papers for this meeting were published a week ago. So we have to, in order to be consistent in the public domain, that's the reason why you've got the version you have. But I did check before I came on, and they've obviously been very efficient and published them while we've been in this meeting. In terms of the involvement and the engagement for the strategy, that is in there in the document in terms of what people have told us. It's in the section around what people have told us. The consultation, as I was just explaining to the chair, that is for the joint forward plan. So all of those statistics you're looking for as to who's responded on that consultation, that is for the next phase and the delivery element of the strategy. So that report is being put together as we speak, and there is a midway consultation report on our website that, as I said, I'll make sure Mike can share with you all. But that's for the joint forward plan. I am really aware there's so many different elements to this. It's really confusing. And it's really hard to sort of try and piece everything together and understand where it all connects, which is why when we've been going to some of our place committees and place health and wellbeing boards, we've been going collectively with the places to try and show it's a bit like Russian dolls and how it all fits together. But it's just understanding that consultation is for the joint forward plan. There is a section in the strategy that you've got there that describes what our people have told us, and they are the things that you would expect to see, if I'm honest. And in terms of the things that were fed in from this committee in September when I came, that should be reflected in that strategy. In terms of the approval to next week with a partnership board, that is subject to final amends. So as I said at the Wakefield committee a couple of weeks ago as well, we've really got till the 30th of March 31st of March for us to be able to still make tweaks to the document. So please be assured of that. There is still that opportunity to feed in. Because of the election period, we don't intend to have a public launch for strategy until post-election, and it would be helpful to do that alongside the delivery of the plans, as you'll see from that paper in partnership board. So there is still the opportunity to be able to feed in comments from yourselves in this committee, just to assure you of that.
Yeah, can I come back, Chair? I think that this is part of the problem is timing. I understand that, but the papers were going to go live today if it's the meetings on the 7th of March. So why couldn't we have had an updated copy emails round to us before this meeting, so that a lot of our questions would then have been more valid, wouldn't it? Because the paragraph that I asked you about has completely changed, for example. Okay, so there would have been some valid points, and I think we're all used to receiving things via email, and I think that would have been really, really helpful. Access to primary care is a key thing that people have heard from people living in West Yorkshire. So and the deep concerns are reflected in the paper, but there isn't a lot about how the strategy will address those concerns. I appreciate some of it will be in the delivery plan, but surely there should be more in the strategy as to the way forward, the strategy as to how that is going to be addressed, rather than just saying, well, we've increased the number of appointments. In actual fact, people do have a lot of problems getting an appointment in the first place. So, but the strategy just is a little bit silent on that. Thank you.
Thank you, Councillor Smage, and I apologise. I take on board your comment. We probably could have done that outside of the meeting, so my sincere apologies on that. In terms of the access to primary care, it's, as you said, a lot of that will be in the detail of the joint forward plan. The ambition for primary care and neighbourhood working is there in the strategy, but that detail will be in the plans.
So could it be stronger in the strategy? And I'll leave it there because colleagues are waiting.
Okay, thank you very much. I'll call in Councillor Harrington.
Thank you, Chair.
Councillor Harrington?
Yeah, thank you, Chair. It was just to say that the Health and Wellbeing Board at Leeds, we had a workshop with Esther, and I felt that was really, really helpful. It's just a shame, I accept everybody's points here this morning that the timing of this has been really, really difficult and really tricky. But maybe in future, if there are going to be any consultation rounds, that maybe we could look at doing that for this board earlier in the process, because that seems to be what the theme that's coming. This is my first meeting of this board, but that seems to be the theme that's coming out this morning. It's about timings of things that we need to look at, and we're not being given much opportunity to do that if we're getting things at the last minute, or as we say, the paper we've got here is actually out of date as we're reading it. So it's just to say that the Health and Wellbeing Board workshop I felt was an extremely useful piece of work, and also how it links into Health Watch Leeds as well, because they had quite an input at that meeting. So it's lessons to learn for future consultations. Thank you.
Thank you very much, Councillor Harrington. Councillor Soloway.
Thank you, Chairman. As you know, I sit on this committee as an appointee from North Yorkshire County Council, much of whom get a lot of their healthcare services provided across borders. As you know, we've also joined the campaign to have Airedale Hospital rebuilt, and we're very much supportive of that. We don't have elections until 2027, so we're not really affected by things so much. So in many ways, I've looked through this report. I welcome it. I've got some possible opportunities here. As you know, we've recently become a unitary authority. We're going to inherit quite a number of redundant buildings, underused buildings. If any of the healthcare trusts want to move into any of those buildings, I'm sure we would look favourably on it, because we've got to rationalise our property portfolio as well. So yeah, I'm encouraged by this document, because I think when you've got a population that you represent who are served by a lot of the West Yorkshire health boards, I think it's a good thing that we've got this forward plan. Who knows, we might have an elected mayor by then as well, by 2024. That's coming. What I'm very pleased to see is a recognition of unpaid carers. 400,000 in West Yorkshire. We've got large numbers in North Yorkshire as well, and having that recognition that they are under-supported and could be supported much more, I very much welcome that is mentioned. Yeah, there's maybe an opportunity for healthcare trusts to maybe look at there might be some opportunities with buildings and property that they might want to use some of ours and have some cross-border opportunities there. I'm sure North Yorkshire will look favourably on it.
Thank you.
Thank you very much.
Thank you, Councillor Holloway, and I know we're also coming along to the North Yorkshire Health and Wellbeing Board on the 17th of March to look at the Health and Wellbeing Board, the strategies together, the integrated care strategies, because of the Craven aspect. That's really important. Yeah.
Thank you, Councillor Swift.
Yes, Chair. I suppose clarification in the main, we now understand that the public consultation in recent months has actually been over the joint forward plan, right, rather than this strategy. Is that available was that available in draft form for that consultation?
So the joint forward plan is just starting to be developed. So that's the consultation. And this is another element of the guidance that's come out nationally in terms of how we develop the joint forward plans and the need for us to have that statutory consultation. In an ideal world, you'd do it the other way around, wouldn't you? You would have a document to be able to consult with the public on, and it's not the way the timelines are set up doesn't allow us to do that. So we've had to consider this consultation in terms of it's about delivery of the strategy. So we've kept the questions quite broad about sort of, you know, your concerns about healthcare services, what's important to you, those kinds of questions. But unfortunately, the timelines that have been set nationally have really restricted us on how we do that, unfortunately. We've been able to start this process. A number of other areas haven't actually started their consultations yet. We were really mindful of the election period and making sure that we started it as soon as we possibly could.
So when you speak about a delivery plan, is that the same thing as the joint forward plan?
It's exactly that, yes. The joint forward plan describes delivery of the strategy. Okay.
Now, now given that we're going to see over the next few days the next version of this strategy that we're talking about today, and the point that you make that there will be some scope for tweaking, okay. But also your comments that in many ways, a lot of our concerns relate to things that will be primarily dealt with in the joint forward plan. Which are the bits of this strategy that we need to pay attention to? You know, which are the bits that are really rather irrelevant, however worthy, and will be superseded by the joint forward plan, and which are the bits that if we don't get a grip on them now will come back to bite us? Thank you, Chair.
Thank you. Esther, please.
Thanks, Councillor Swift. And I mean, in reality, it's all important. It's setting the vision, it's setting the ambitions, it's setting our plans for the future, our North Star, as I said before, that we will be working towards. It's basically describing the future we want for West Yorkshire. So all of that bit of it is important. The delivery bit is obviously the next stage of that. So I get what you're saying, Councillor Swift. So I suppose it's sense checking that you're happy with the direction we're going in and what we want the future to look like for West Yorkshire. Is there anything missing? Is there anything that you feel really strongly needs to be reflected differently? I would say it's more about that, and then that detail we will work with you on over the next few months.
Thank you, Chair.
Thank you very much. You happy, Councillor Swift?
I'm better informed, Chair.
Okay, that's fine. Councillor Hutchinson.
Thank you, Chair. In terms of timescales, you were saying that a new plan is going to be produced every year. Well, public health measures, their impact takes many years, if not decades, to be felt. and setting up departments, services, assembling teams of specialists to perform a role, staffing maternity hospitals, for example, is again a long-term project. And I've seen it happen over and over again within the modern health service, that it's a bit like a lighthouse beam swinging around. One week, there's this priority, everyone has to jump to that, and then the beam sweeps on, and the following week, something else is the priority. And that really is a major obstacle to developing the long-term infrastructure that's needed to develop services and the long-term funding streams. So I am alarmed at this idea that there's going to be a new plan every year, that there's going to be permanent revolution and nothing gets a chance to actually bed in. How is that going to actually be managed in a sensible way?
Thank you, Councillor Hutchinson. So it's not that it will be a new plan each year, it will be reviewed and refreshed each year. So it will be sort of give us an opportunity each year to look at what we've achieved, how people are experiencing care and services, how life is feeling for them, and you know, what impact do we think we're making, what's
Have we lost Esther?
I think so.
Oh dear. Okay, she's definitely frozen. Okay, Mike, do we have a way of reaching Esther by phone just to see what the problem is, and then we can decide what to do from here?
I was just trying to do that.
Thank you. That would be helpful. Yeah, we definitely have lost her because she's gone off screen now. So, right, okay. I believe we definitely need a holding brief on this one. Committee members, you will all agree we do not have the sufficient information that we all need to be able to actually scrutinize and do what we ought to do as board members. So, Mike, I think we would need to hold a meeting after this, if that's okay. Can I just go to your agenda? Because there are certain things that I would love to say, but I would just need us to discuss that in private with just the committee members, if that's okay. So if we move on to the next agenda, which is yourself, about our next steps in future, and then we can officially end the scrutiny meeting. And then if all board members can stay behind for a brief discussion, I will be grateful. So over to you, Mike.
Okay, thank you, Chair. Well, I think in a sense, because we've agreed to have a further discussion about timescales and additional meetings on the work plan, the final agenda item is a little bit redundant, because I think the feeling of the meeting is you do want an extra meeting before the new Joint Scrutiny Board is assembled after the annual meetings of councils. I would suggest that we have that discussion after this meeting, when the meeting is closed, unless members want to raise anything in public at this point about the future work programme. So for the benefit of the public, I think the members of the board are keen to have a more structured forward plan, a schedule of meetings for the year that will be published before the year starts, I guess. And also to have an additional meeting to pick up on some of the points that Esther, who now fortunately has rejoined us, has been making. And Esther, we've just moved on to the last item, which is, given that we lost you for a few minutes, and it would be useful to have a view from Esther now, if possible, but it may not be possible, about a sensible timing from Esther's point of view for the additional meeting we discussed during the previous item. And then we can have a discussion. The members of this committee can have a discussion about how that would fit with their own arrangements. That's all I think I need to say. That's all I need to say, Chair.
Okay, thank you very much, Mike. I can see Councillor Hutchinson's hand.
Yeah, I just wanted to, I'm not entirely sure how we make sure that people's concentration remains on the underlying important, making sure that disease prevention, ill health prevention remains a focus despite the sort of day-to-day priorities that crop up, and that it doesn't always get undermined. The other thing that, based on this idea that, there is a continuity that needs to go on, and this strategy all refers to will. It doesn't actually say what we are on with at the moment and whether, and we will continue that, or what the impact of what we're doing at the moment. It's all sort of aspirations for the future, without any acknowledgement that stuff is supposed to be going on in all of these fields at the moment.
Thank you, Councillor Hutchinson. Esther, we'll bring you in now. Thank you.
Thank you, Chair, and I do apologise. My internet is not the greatest in the world. Perhaps I should have a strategy on that. Just going back to the point that I was covering just before I lost connection with Councillor Hutchinson. Just to reassure you, I don't know whether you will have heard me say that the joint forward plan it's a refresh and a relook every year to check what we need to do differently, and if there are any changes that need to be made. It's certainly not a new plan, just to assure you of that. And what you were just asking in terms of the here and now, that's exactly why we've tried to connect the operational planning, which happens every year in the NHS, as you'll know, with the joint forward plan, so that we have a strategy that describes our future. We have a joint forward plan that describes what we will do for the next 5 years, how we'll do it, where and when. And then the operational plan is the here and now. That's year one, the detail, the finance, the activity, summer and the workforce. Because you're quite right in one of your earlier comments about the sort of some things are for the future. Workforce, for example, that takes a long time to make some of the shifts in terms of how long people are trained for as well. So it's really tricky balancing that here and now. But by having those things all connected together, hopefully that should make a little bit of a difference. And just to go on to Mike's comment about timing, what I don't want to do is I don't want to repeat sort of any challenges around you're having the best engagement in this process. So what I would suggest is perhaps if there's a possibility for this committee to come together, perhaps mid-May, to start to look at where we're at that point with the document. I'm not saying that will be a final draft necessarily at that point, but it will certainly be a good amount of detail that we can share with you and we can have a good conversation on, so that there's still plenty of time for us to be able to weave into that and to be able to just make sure we're addressing your concerns really well in that joint forward plan, if that sounds okay. I appreciate that's really tricky with elections. I do understand that. It's trying to find the best solution. I'd certainly take your advice on how that will work best for you as a committee as well.
Can I just reiterate the point that I made about data, that if there's going to be an annual review of progress against the plan, it's important that you have timely data against which to carry out that review, and that seems to be a significant gap at the moment. Thank you, Chair.
Yeah, absolutely, Councillor Hutchinson, agree. Councillor Rhodes and then Councillor Swift, please.
Thank you, Chair. I think in coming to some resolution of the information we've had today, it's important from this committee's point of view that we actually minute our concerns. First of all, as been pointed out, that the new document, as we'll put it, is out today. And again, even though it's been tweaked, the role of the JOSC hasn't had any consideration ahead of it being published today. I think it's important that involvement and understanding of the role of JOSC and indeed the local place committees as well has a role in the overview of such documents, and indeed time, if necessary, to consider what has been tweaked. Is it of value? Is it a change? And is it something that has come forward through consultation? I think it's worth minuting as well that in the future planning that's going to go ahead and the joint planning, that the committee recognises that those plans have got to align themselves, not in a general state, but in a planned process of delivery to the topics of the 10, because otherwise it's fragmented. And it would be easily monitored from the JOSC or the place or the Health and Wellbeing Board by the association with which plan went where. Being cynical, I have to say, I worked in the health service for 20 years. I've seen more plans, more restructuring, more tweaks, more visions, more strategies, and more joint plans that could paper the whole of Wakefield and probably Bradford Kirklees as well. What I'm interested in those plans is the outcomes. And the joint plans for the future, I believe, as Councillor Hutchinson has said, Colin, should actually have data associated with them that proves that there is an outcome delivery, not something that's a wish list for next year, we'll tweak it next year, or it's going to now drop back to the second year of the 5 year or the third year of the 5 year. And I think that those are the things, Esther, that any planning process should have and should be accountable for. We all are aware, and we're not naive enough not to think that as the years go by, there will be some tweaking. What I'm interested in is knowing what the value of those tweaks are and how they're going to benefit the patient. We have a hierarchical structure in place at the moment, which is very, very, I say, awkward for the public out there to understand what it's about. And I think we have a responsibility within that where we can to have that overview with your good selves, not a 12th hour situation, as I believe today has been in terms of the document that could have come here today. And I think that that's something that we ought to make clear from today's agenda, Chair, and the outcome, that it's disappointing that having spent time at the local place, and again with your time today, Esther, and thank you very much, that we're here saying that basically the document we've had today is not now the real document. And I think that's very disappointing from all of us, Chair. Thank you.
Thank you, Councillor Rhodes. Esther, do you want to respond to that?
Thank you, Councillor Rhodes, and I take on board all the feedback. I honestly do, and some of the challenges nationally around some of this have been difficult, but I completely take the point that we could have shared via email the document. So that's a learning point I will certainly take away. It's not the way I would want things to be. I completely agree in terms of the data, not just the data, but that experience of care as well, which is really important to me that's factored in. But we need to be able to really evidence the impact we're making. And I think you make a really good point about if there are changes made every year, what's the value of those changes and how will that impact on patients? I think that is an incredibly important point. In terms of the aligning to the ambitions with the place plans, that's one of the requirements of those place plans, is that they illustrate the contribution to those 10 big ambitions, because I think over the last sort of two years since we published the first document with the 10 big ambitions, actually it's 3 years now, isn't it? we've perhaps not been able to evidence where all parts of the system are contributing to that 10 big ambition. It's just been that overall data, which doesn't necessarily reflect all the work that's happening and therefore all the impact it's having. So hopefully this new way of having these place plans that are built into the joint forward plan will perhaps better show that impact that's being made.
Okay,
Thank you.
many thanks, Esther.
Thank you,
Sorry,
Esther. Thank you. Thank you, Esther. Just to comment for the members of the board here today, that Elizabeth, Councillor Smage and I were in shadow with this particular change of direction to ICBs for 5 years. 5 years. And I have to say that as it's progressed to fruition, I had hoped that from being in shadow, that some of the members would actually have had some intuition about the role that we play together. That's the disappointing thing about it. But Elizabeth and I, Liz, we've long memories on this in terms of process and plans. Thank you, Chair.
Thank you, Councillor Rhodes. Councillor Swift.
Yes, Chair. I'm not sure whether Esther will still be with us when we go into private session later or not.
No, she won't be.
Thank you. A couple of points of clarification relevant to the discussion we'll have. Could Esther confirm when she expects the draft forward plan to be available for us to look at?
So, Councillor Swift, what I would suggest, given the election period, is that if we were to reconvene straight after the election, then we will have something to share at that point.
Yeah. I mean, my question actually is is directed to whether the right time for us to meet isn't earlier than that. First of all, because I think we'd like to get some of the things progressed that we might have hoped to have progressed further today. And secondly, because mid-May, they can be quite problematical. I don't know how many of us present will still be around. I suspect most of us, but also responsibilities get shuffled around as well. So that the meetings around and about that time are a lot better if they're devoted to, freestanding items, and that they're not very well suited to picking up the loose ends from things that there's a fair bit of previous process on. So I would certainly like to see us meet again sooner than that. I don't actually think that there's a great deal that we've been talking about that is actually sensitive at all in Purdah terms. I would have had difficulty if I'd been a member of the public looking in on this meeting. I would have had difficulty working out which political party the different faces on screen are from, by their comments or whatever. And I'm also conscious that while the things we're talking about are actually important and will ultimately affect the delivery at the sharp end, that from the point of view of the public and hence from the point of view of electoral sensitivity, most of what we're talking about is very, very dry. Is dry bureaucracy, important bureaucracy, but nonetheless very dry. And I personally don't think there would be any great sensitivity in this being dealt with during April. Hence my question about how soon can we see the draft forward plan.
Thank you very much, Councillor Swift. So one of the things that we need to discuss in private will be timing. So do not worry about that. And that's why we're Scrutiny and who we are. So Esther, we just want to say a very huge thank you for your presentation. Mike and myself will be in touch with you straight after this. Obviously, we're going to go into a private session, and just to say thank you to the public who have tuned in to listen to us today, and we would definitely be coming back on this same agenda item as soon as we are able to agree a time. So we will come back to you, Esther, with the timings that we have agreed with all other board members. But thank you very much for your time and enjoy the rest of your day. Thank you.
Thank you.
Mike, sorry, Mike, you want to quickly say something before Esther leaves us?
No, other than thank you, Esther. Just to remind members that until Kirsty comes back in, I've just messaged her, we're still on the live stream. And she's there, as if by magic. So has the meeting concluded now, Councillor Marshall Catherine?
Yes, can we just also wave thank you to Esther, and we hope to bring you back soon. So thank you very much, Anne. We officially have